Our mission statement is to create enduring health equity through this Activate, Accelerate, Transform model, where we're working with communities and with policymakers to create a feedback loop where everyone's learning from each other, from the cutting-edge science and the cutting-edge research, creating some really unusual and exciting opportunities for change.
If there's one thing that I learned after being in state government for over 25 years, is the importance of listening.
When you're really listening, you can't be thinking about what you're going to say. If we stop for a moment and we really just take in what the other person is saying, we often are able to come up with better information, better ideas, better opportunities than we would on our own.
One of the points that was made near the end of today really had to do with trying to work together as a community to solve community problems. I was very impressed with the model that has evolved.
We're starting to build a community of people that reach out to each other. They reach across cultural divides. They reach across, all the different barriers that we fictitiously put in place.
So Foundation for Healthy Generations works with communities to listen and observe what their particular issues and concerns are, and then helps them look for policy or systems solutions.
We encourage dialogues about really deep and meaningful questions that range from questions about problems to questions like, what's radically right here that you're building on? And we end up hearing from people this amazing story of what they're trying and what they've learned and how they want to apply learning for the next round of their work.
Population health is really about trying to find out what a community needs, not just medical interventions, but what are some of the issues that imperil our residents. And so what we're attempting to do is really focus on new relationships and new ways of reaching people.
And so in some ways, what we do more than anything else is try and work with the community to say, who is it that you trust? And then really reach out to those trusted members to try and support them, because they're much better at being able to engage people because they know the right questions to ask, they know who cares about what issues, they know what is culturally and linguistically appropriate in their community. Their members.
Being low income, everybody wants to come in and save us or fix us. And what I felt we need was to be empowered to take care of ourselves.
How do we bring representative voice forward in the discussion instead of leaving them out and just having them implement or be forced to fit into boxes that get decided without them?
How do we mobilize people at the grassroots level to focus on some of the more important health factors right now that will help bring about change in our community?
In fact, communities can solve most of their own problems. What they need is support in doing so.
So a community health advocate is someone who is a trusted neighbor that people naturally go to, and we are trained to address the most common health problems within our community.
It can be a very insular world to be in the policymaking world. Folks who are doing research are often very frustrated by the difficulty bringing that research out into the world and having it impact action in the world in a way that is transformative.
I think the biggest challenge is trying to take something that is really scientific and actually put it into something that's palpable for people.
We use the data to ask questions, to say, the statistics would indicate these kinds of challenges. Does that resonate with you here? Does that make sense? And local people always inform the data and help us have an accurate story.
Just having the data that they are bringing to the table, bringing to the conversation is a huge step forward.
I attended Chefs Prevention Alliance meetings, and for me it was a great opportunity to meet other people working on legislation and really kind of work more collectively toward the same ends.
A challenge that I see is getting this messaging up to our policymakers that make the decisions about what really we value. And so how we can do that in a way that they actually hear us.
We have often cited the foundation as a real leader in the effort to be able to get information out. You would think that was, the easiest part of what we do, but it's not.
This is one of the most significant, I think, contributions that the Foundation for Healthy Generations can make to our community. We have so much scientific information available to us, and that information needs to be translated, it needs to be disseminated, and we need to make sure that the right people understand the implications of what it is we know. And we know a lot.
What does hope-filled action look like?
I think hope-filled action to me is when people are taking action that they feel will make a real difference.
We can't leave the conversation with the trauma. We have to also have assurance of hope, of recovery, of resilience, of bouncing back.
I can think of nothing else that would create a foundation for hope and a belief that you actually could act on that hope and that you would get somewhere than bringing communities into those conversations and actually being able to see the impact of their voices.
I think the opportunity to make a difference is what all of us are looking for to enrich our lives.
There's a lovely poem, and I wish I could recite the whole thing. But in it, the Hopi elder says, "We are the ones we've been waiting for." And when people hold that in their hearts, that's hope-filled action.